everyone, I'm Ava. I'm a licensed master esthetician with 15 years of experience working on skin. Today I want to discuss our intake forms. We ask a lot of questions on our intake forms, and they're for a very specific reason. We want to get to know more about you, about your medical history, about your past experiences with your skin, any hormonal fluctuations, antibiotics, antidepressants. These are all very important to keep in mind. Today I want to highlight one very crucial piece of information that we definitely do need to know as your providers, and that is history of cold sores. Cold sores are kind of a taboo subject, but it's nothing to be ashamed of. Something like 50 to 80% of Americans actually have the HSV virus in their body, whether they're aware of it or not. We're not asking you these questions to shame you or make you feel uncomfortable. We're asking them for your safety, for ours, and for our other patients. Now let's get into why knowing about your history with cold sores is important when it comes to skin treatments. While this virus may lay dormant in your body, it can be triggered with any sort of aggressive treatment we might do. If you have the virus, sometimes you've noticed if you get sick, you'll flare up. If you go in the sun and it has UV exposure and a sunburn, you'll flare up. If you've maybe waxed too aggressively, you'll get a cold sore flare up. The same things can happen in the treatment room, and we want to make sure that we are treating our patients safely and effectively. And in a lot of cases, if you have a history of cold sores, we will give you prophylactic antivirals just to make sure it doesn't flare up after the fact. Now, if you walk into the treatment room with an active cold sore, chances of me saying I will not treat you that day are almost 100%. If we're treating maybe forehead or somewhere nowhere near that cold sore, I might be a little bit more lenient. But as far as treating over a cold sore, an active cold sore area, that's an absolute no. It's a hard no. Not only is it unsafe for you because we can spread it, we can transmit it to ourselves by accident. It just creates a whole slew of problems. So as a safety precaution, we don't go anywhere near an active cold sore breakout. So when you're scheduling your appointments, be aware of this. When you're filling out your consultation forms, please be very, very transparent if you know you've had a cold sore. Some of us don't know. Some of us might do a treatment and it pops up. Did you get it from the treatment? No, you did not, because we have safety precautions in place. That virus was probably dormant in your body, and this was the trauma that caused it to flare up. So cold sores are not a contraindication. Active cold sores are. History of cold sores is not. Be honest with us, be transparent. We're here to help you. We're here to do your treatment safely and effectively. If you're interested in scheduling a consultation or learning more, you can find me at Expert Skin Solutions in Tysons Corner, Virginia.